Now it's time for Onpoint, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. The number of new daily COVID-19 cases in South Korea reached a new record high on Sunday, topping 56,000. The rampant spread of Omicron driving the surge, and it looks like it's going to get worse before it gets better.
A local state-run think tank recently estimated the figure could be in excess of 350,000 new cases a day by early March. For more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
So with this current rate of spread, it seems like a lot of us are eventually going to get the Omicron variant. So if we're feeling under the weather, what symptoms should we look out for?
Right. Someone had come up with the term flu-rona to describe a combination of influenza and COVID-19. And I think that's probably an adequate description of the kind of symptoms that you might expect with the Omicron variant. In other words, there can be a fever, fatigue, cough, headache, runny or stuffy nose, and sore throat. Some people have complained about body achiness, especially backaches as well. But as you said, this winter season, if you have any cold or flu symptoms, the first thought that comes to mind should be, is this COVID? And then the second thing to do is to get tested.
Okay, that makes a lot of sense. Now, South Korean officials, as we heard from Shin Ye-eun just prior to speaking to you, there are plans now for this fourth booster shot being given in South Korea, most likely to high-risk groups first, as you would expect. What do you think this plan is going to look like? And also, do we have data that really shows now, at this point, now we're on the third, fourth booster shot, that these booster shots mean fewer hospitalizations and fewer deaths?
Right. Well, we do know that the third dose booster has been effective in preventing severe disease. We do have data to support that. In terms of the fourth dose, a fourth dose has been recommended for people with immunocompromise. This is a recommendation that's already been in place. But in terms of applying a recommendation of a fourth dose to other vulnerable groups, such as the elderly or even the public in general, unfortunately, there are not a lot of data to support the use of a fourth dose. The Sheba Medical Center in Israel performed a small trial of using a fourth dose of the Pfizer vaccine. And what they found was, after the implementation of a fourth dose, antibody levels did go up. And they actually went up higher than after the third dose. But unfortunately, because now the Omicron variant is the variant that's dominant around the world, even the high antibody levels from a fourth dose were not enough to effectively block infection due to the Omicron variant. And so that is the biggest concern. If we were dealing with the Delta or previous variants of concern, certainly a fourth dose probably would have been helpful, but with the Omicron, it's hard to know.
Now, let's turn to Novavax. The vaccine is due to be distributed here in South Korea today, and the government hopes unvaccinated people will be more inclined to getting this shot because it's not an mRNA vaccine. So can you explain to us how the two types of vaccines differ, and do you think many unvaccinated people will get it eventually?
Hopefully, for the 2 million or so unvaccinated and under-vaccinated adults in Korea, and the people who have been hesitant to get an mRNA vaccine because it's such a new vaccine technology, I hope that the Novavax vaccine offers a safe and effective alternative for them. So if anyone has received a flu vaccine in the past or a hepatitis B vaccine in the past, then they should know that the Novavax vaccine uses the exact same technology, the same platform. And so there's really nothing new about this platform. It's the same old platform, but it's been updated because it's using a nanoparticle. It's a recombinant protein nanoparticle vaccine that has been adjuvanted. Adjuvanted means there's a special chemical that gives the vaccine a boost in terms of its immune response. In terms of the side effect profile, also a very favorable side effect profile. In terms of side effects, most were mild or moderate in the phase 3 trials, and they were short in duration, very transient, lasting maybe a day or two. And so for the people who have been hesitant about using a COVID-19 vaccine, one, because the technology was so new, you don't have to worry about that with Novavax. And then secondly, because of the potential of severe side effects, that also seems to be less of a concern with the Novavax vaccine. So I hope that this can be deployed among our unvaccinated, undervaccinated, and our the people who had difficulty in accessing the vaccine previously.
Yeah, we speak to Professor Cowling at the University of Hong Kong, and he gave a similar glowing review of the Novavax vaccine, so that's good to hear. But finally, on the social distancing guidelines, it's fair to say, it seems like to me anyway, that the social distancing guidelines we have in place currently are like a hangover from what we were dealing with when we had Delta and all the previous strains. It hasn't really been modified that much. Considering Omicron is so transmissible, would you think that at some point the government's going to have to go back to the drawing board and really overhaul how these guidelines look now? Or perhaps, like other countries have done, just scrap them altogether and let's go back to normal life living with the virus?
Well, first of all, I have to say that there are few countries around the world that have taken such a vested interest in protecting its people, taken such a sense of responsibility for all COVID patients, as has South Korea done. In terms of the Omicron variant, Dr. Mike Alsterholm, who is one of the premier infectious disease and epidemiology experts around the world, he says trying to block Omicron is like trying to block the wind. Basically, it's impossible. You can divert the wind, but you can't block it altogether. Our strategy, of course, has been to prioritize the protection of the vulnerable groups. And we did this through a very aggressive booster campaign. And I think that was the strategy that's been working so far. In terms of the social distancing measures, my concern is this. I don't think we've had enough of a discussion about the effects of long COVID. And, we know so far that it can affect up to 1/3 of everyone who's been infected with COVID-19, even people who had mild symptoms. And I think this message needs to be broadcast more. More people need to know that even if Omicron causes mild disease, so-called mild disease, there is a possibility of long-haul COVID even after Omicron. And so people should take their personal responsibility to try not to get infected, because there's so many unanswered questions about what post-acute COVID syndrome will look like after Omicron. And if we let, millions of people, say, potentially get infected with Omicron, that can be a huge burden on society and also a personal burden, a medical burden on individuals.
All right, Dr. Tan, as always, thank you so much for your analysis, and we hope to talk to you again soon.
Thank you.
Thank you.